Hello guys, this is your favorite doctor for free once again, you from New York City. I was going to do one of several topics that I marshaled out earlier, but something struck me to take on the topic I'm going to discuss this point. The ailment might not be rampant. It's not as rampant as most other ailments, and it can be misdiagnosed easily in Nigeria with catastrophic results. This is because it is a time-sensitive illness that needs immediate intervention appropriately. This topic I'm going to discuss is called Bell's palsy. It is also, like for medical people, the lower motor neuron paralysis of the facial nerve. Facial nerve is the seventh cranial nerve in the body that controls the movement of the face. So there are two of them, one on the left, one on the right, and depending on the area, the division, you have the lower motor neuron and the upper motor neuron. So Bell's palsy, like the bell you ring, B-E-L-L apostrophe S, palsy, P-A-L-S-Y, which is medical term for paralysis. It's just the paralysis of the facial nerve, mostly of the lower motor neuron section. The reason it's so scary is that it is easily mistaken for stroke, cerebrovascular accident, popularly called stroke. And this is why it's so scary, because anybody that has it would immediately think he or she has stroke. And of course, all the helter-skelter that is consequent upon the diagnosis of stroke. Why did I decide to take up this topic? Because it hit home. A very good family friend of mine reached out to me some months ago, rather inadvertently, because she had gone to work, and she called me from work. And this is a lady that helps me a lot anytime I visit Nigeria. So this was a Sunday evening. She's at work in the airport, and she called me. Most people that know me know that I'm a busy person. It's difficult to reach me, but coincidentally, or by dint of nature, how God wanted it, she got me. And then, after the usual banter, she mentioned, oh, I thought I was 17 years old or 18 then, but not more than 18. My 18-year-old daughter developed symptoms of stroke on Friday. Immediately, that bell rang in my ear, on my brain anyway, it's ringing like I immediately, without looking at the patient, with this patient I had no risk factors for anything, I knew it would be Bell's palsy. So I said to her, tell me how the stroke presented. She woke up in the morning and lost feeling on the left side of her face, and it became flaccid, not much movement. And I said, okay. My first question was, when she showers, does water and soap enter her left eye? I said yes. When she puts food in her mouth, does it drop off through the left side? She said yes. Is she able to close her left eye against resistance? No. Of course, I didn't ask for wrinkles. It's a young girl that had no wrinkles, but in elderly people, they will lose the wrinkles on that side of the face. The face will become flaccid. And of course, there's numbness on that side. And it's just across from the top, the forehead down to the jaw, that side. And your mouth will be drawn to the other side. Yes, a droop. The nasolabial fold, the fold that runs from the tip of the nose to the edge of the mouth on that side, because the whole muscles will be paralyzed. It's scary. I mean, when I'm mentioning it, it might sound like alien to you. Like, what is it talking about? Most of you should browse what it looks like. It mimics stroke. So this young girl developed these symptoms. Of course, she was in panic. The parents were in more panic. And of course, they are not entirely uninformed. And they're middle-class people. So they went to a big hospital in Lagos with opulence, of course. And they met the big consultant, those ones that wear suits all the time with their briefcases, consultant, who looked at this poor kid and told the parents that she's having stroke. So it was a Friday, right? And they ran some tests. They were unable to do CT scan that day. Maybe it was broken or something, but this poor kid was scheduled for a CT scan the following Monday, 2 days later, right? No, 3 days later. They ran a lot of tests, blood tests and all that. And the results didn't even come out. They were told, when you come on Monday for the CT scan, you get the test. Some of you might be wondering if I'm talking gibberish, but this is what happens over there. You run tests and you wait for days. And X-rays, you wait for days. CT scans, you wait for days. Anyway, they were told they couldn't do a CT scan for the stroke. I compare this to management of race stroke. That's laughable anyway. But I'm trying to bring us something. This ailment is not rampant, but when it visits you, how scary it is, possible misdiagnosis, and how simple it is to treat is why you need to listen to this topic. So when the mom called me, and just over the phone there, without looking at the kid, I told the mom, your daughter has Bell's palsy. And when I checked the time, it was almost 40 hours. I told her, you need to leave work now, run like you have nothing else to do, go to an all-night drugstore, which we call chemist in Nigeria, and get yourself a high dose of Prednisone, a steroid. That's what your daughter needs. If she does not get this within 2 days, that is within 48 hours, then all bets are off. Paralysis, the after effects will last longer. But if she's able to get this steroid within 48 hours, high dose up to 80 milligrams, 60 milligrams, high dose for a week or thereabout, then the paralysis will disappear. Of course, needless to say, as the woman was rushing back home, she already called the husband, and they went searching for a nice chemist shop store and purchased this medication. By the time she got home, they called me on video, and of course I confirmed what I had already suspected. 17 years old, with no risk factors, developing stroke. And that would be one of the few occasions that the Guinness World Book of Records will have to come and document. Without this, there are people that have clotting issues and all that. That's different. So, needless to say, this poor kid took the first dose of steroid. By the time it was morning, she was almost 90% resolved. When the parents called me and said, should we still go and meet this consultant and do CT scan and do? I said, oh, well, if you have money to burn, go ahead. Knock yourself out. But if you were my sister, or you were my brother or cousin or somebody that is under my care directly, you dare not even ask me that question. Ask me that question will invite a lot of opprobrium. So, as I'm talking to you, the kid never went back to get the lab results or even any CT, and the kid is perfectly fine. So I'm trying to a few that might be in similar situations, even for adults. Bell's palsy is paralysis of the facial nerve, lower motor neuron section, that can mimic stroke. When you get this, especially in young people, even adults, please think of Bell's palsy first. Of course, what are the causes? Majority of the cases are idiopathic. When we say idiopathic in medicine, it means no known cause. Some of them have been related to viral infections, We have all these measles and all that. There was just all over the place, just living as hell and reserving on their own. So they could be implicated. It's only in a very small proportion of cases that you could have maybe some mass in the auditory canal or anywhere that the facial nerve courses through that can be irritating. It's just some irritation, fluid, anything that, those just those make up a small fraction. So there's also a case being made for giving antiviral therapy. Like I told you, viruses are like essentially untreatable. They resolve on their own. Could give all these antiviral medications to decrease their replication and multiplication. So a case has been made for that. You could add that, but in most centers, just the steroid alone will do the work. And I hope we'll be adding some schematic of, pictures or some short videos to show it, what that PALSY looks, so that people will appreciate. I had to do this topic because, although it's not something we encounter frequently, but when you encounter one and you are prepared enough, then you should be. It will save a lot of debility, a lot of disability, a lot of stress, a lot of hassles, a lot of regrets. That's why I felt that this topic is also important and I'm doing it. It's not just that person in one of the capital cities in Nigeria, well-to-do guy that had this, went to the best hospitals in Abuja and they delayed his care. He ended up with some level of disability or poor resolution for a while before he recovered. And when I got involved, that's where I was able to prescribe the appropriate medications and that helped him. But even at that point, he had already suffered some level of disability, some lost manpower, lost work hours. When I say manpower, it doesn't work. So I hope those of you who are listening to this will pay great attention to this, because it might sound like something that is, textbook, something that is far-fetched until it hits home at you. Then you realize, you remember this lecture, and then do the needful. So when it comes, unless there are other factors that intermingling, there's really no need for all those exorbitant tests, CT scans, and all that. It's classical. Once you see it, you'll know it, if you already know it. And if you watch any video about it, even as a lay person, and you see one of your family members develop it, you automatically know. Don't forget, I'm not saying you should self-medicate, but you can go to your healthcare professional and argue. Steroids, given within 48 hours, high-dose steroids. Not anabolic steroids and all that. When people hear about steroids in Nigeria, they're scared. Think of all those things that weightlifters used to build their muscles and people testing positive to dope in sports. No. We live with steroids every day. Without steroids, we'll be nowhere. They're used in, when I say steroids, prednisone and cortisone and all that. There's regular things that we have already naturally in our body. So if we don't have enough, you have to give artificial ones to augment. But steroids keep us alive. Almost every ailment, even cancer treatment, asthma, allergies, arthritis, even osteo and rheumatoid, all those rheumatological disorders like polymyalgia, rheumatic, fibromyalgia. There's just nothing we don't. I don't know if there's anything we don't use steroids for. You're talking about Bell's palsy, talking about, some high falutin illnesses that are not even diagnosed in Nigeria now that, which they can categorize as Obaji or one of those things. Steroids are the mainstay of treatment for them. So remember this and talk to your healthcare professional if he decides to delay your care. Like in that situation that I talked to you about, a family friend of ours that works in the airport, if she hadn't called me, if I hadn't intervened at that point, this little kid would have ended up with longer standing disability. I mean, over time, she would have recovered, but that's over a long time. There's no guarantee that she will have recovered. Because I've seen people that still, 2 years later, still have numbness, still have some measure of disability because they didn't seek appropriate care earlier. So, we thank God that one went well. And this is why I'm coming to you with this message today about Bell's palsy. You should educate yourself. You should equip yourself. That's what we encounter here. Patients come to us fully informed, even at times teaching us because they learn from the specialists that they went to see. So it's nothing. We are human beings. We're supposed to interact with the patients and not show any kind of haughtiness or hubris or condescension and bring ourselves down to explaining to the patients and even listening to them, suggest to us what would be good for them because it's their body. Funny thing, I send people to hospitals over there. I'm trying to talk to the doctor and see how we can reach a meeting point and like standoffish and not accommodating. But if anything happens to that patient, they are not going to be responsible. You go and carry the patient's remains or corpse and go to your house. It's now your loss. But the doctor was acting as if he was the Lord of the manor. As if he had the magic wand to do everything. But when he cows the patient's relatives and anything happens to the patients, they will even hold the corpse until you come and pay your full, the full amount you owe. We need to have a change of practice, a change of attitude. It's really riling, to say the least. As a matter of principle, I don't send anybody to a hospital that the doctor does not wish to talk to me over there. I don't. There are so many others you could send to until most of us will come down there and establish and change the paradigm. Well, thank you for listening. I hope to an extent this has been impactful and helpful to you. And if it has, share it, call your friends. Let them also avail themselves of this opportunity to get themselves and change their perspective towards healthcare. Thank you very much. This is your doctor for free, coming from New York City.